Hi, it's Taylor here talking about health disparity in Virginia Beach or Hampton Roads, which is the overall larger area where I live. It's considered the seven cities, and Hampton Roads are the Tidewater area of Virginia. We're a coastal area. We consist of seven tightly knit cities that the borders are constantly crossed when you're traveling from within any of them, really. But I live in Virginia Beach. So the statistics I have are specific to Virginia Beach. The population is 450,189. 61% of that is identified as white, no Hispanic ethnicity at all. 18.7% Black or African American, 8.3% Latino or Hispanic, 7% Asian, 4% identified as two or more races, 0.318% American Indian and Alaska Native, 0.256% identified as other, and 0.0318 Hawaiian and other Pacific Islander. The median age in Virginia Beach is 36. The median income is $77,059. So some statistics I found for healthcare coverage. 92% of Virginia Beach residents have healthcare coverage. 44% of that is through employee plans. 6.8% is through Medicaid. 7.4% is through Medicare. 19% is non-group plans. 13.6% is on military or VA or Veterans Affairs plans. And then 7.86% are uninsured. So I found a community indicators dashboard for Hampton Roads. It had a lot of listed disparities that are in our area. When we were compared to other cities in the United States, the prevalence of diabetes, heart disease, and stroke, hyperlipidemia, hypertension, kidney disease, osteoporosis, cancer, and asthma were all higher than other counties or cities in the United States. And then when looking at a community health needs assessment that was completed by one of the hospitals that's in our area, it was done in 2019, so it's a little bit more updated information. And then they were also using data about interventions that are available and then the feasibility of implementing those interventions. They listed a number of health problems that are in our area that they feel are more important to address, more currently up to date, and that those were behavioral health or substance abuse. That's linked to the opioid crisis that's going on, obesity or nutrition, heart disease, Alzheimer's disease, or dementia. And then in that health needs assessment, they asked the participants what they felt the factors impacting their access to care were. The top three that were chosen were cost, transportation, and the availability of health insurance. All three of those were considered questions of affordability of care, which is a consistent concern across populations and areas in Hampton Roads. Some additional write-in answers that were listed that I felt were important were lack of providers in rural areas. In Hampton Roads, we do have a lot of rural areas, especially in the more west cities like Suffolk, Franklin, and Isle of Wight and Smithfield. Those are where we have farming happening, some more meat plants, so everything's kind of really spread out there. So providers in those areas can be difficult. I know when I was working in school-based therapy in Franklin, we had one therapist between the entire district, but getting from one school to another took an hour and a half, and that was pretty typical. So imagine having to go to a hospital there, that would be difficult. And having access to specialists, you're probably traveling outside of your city. Fewer providers of service are available in evenings or weekends, making it difficult for working parents to take time off. So this is important when you're thinking about families that have a lower socioeconomic status, so they can't afford to take time off to go to the hospital or take their kids to an appointment or take themselves to an appointment, so their version of healthcare is going to look a lot different. Someone wrote, there's no support network for families, and if there is, then where is it? So I think there's a bigger disconnect in finding access to any resources, and I also had difficulty finding resources that we offer in the area. So there are some listed in the health needs assessment, and I'll go over those, but I think that is a big thing. Like, people don't necessarily know where to look for that, and I think health literacy kind of ties into that. If you're not aware of what the resources are, but also what type of care you're looking for, it's going to make it that much more difficult to look for the services or the resources that you need. There's a language barrier. I've heard this from my friends personally that are married to service members, and they're coming from other states where, you know, Spanish is spoken there, and it's normal because it's a higher Latino or Hispanic population. So then coming here where that's not the norm, there is a little bit of a language barrier, and this can create issues with actually seeking out care or being routine with your care because there isn't that competence in culture. Let's see. And then one more, I cannot retire because I cannot afford the cost of my current health insurance. I think this is just a nationwide issue at this point, something that will have to be addressed, you know, through legislation across the nation. I know Healthy People 2020, a lot of our goals in Hampton Roads for that, according to the health needs assessment, we still have a lot of work to do. And I think actual resources and access to those resources is a big part of it. So then there's a brief summary of the key findings. And then here they kind of go over more serious health problems in Hampton Roads. One of the top things is access to programs for children with special needs. And I think that's a big one, especially when you think about the person that wrote in about not being able to take off of work. Economically, it's not feasible. So I think that's important. And that's one of those pockets. And one of the geographical pockets where that's probably going to be is in the rural area or in one of our more urban areas in Norfolk or Portsmouth, Newport News, those towns, also a little bit of Virginia Beach too. Lack of services for special needs children who become adults, support for caregivers, including physical and emotional support, access to affordable health care and supplies, lack of knowledge related to how to navigate the healthcare system, opioid addiction and overdose, mental health, lack of resources to pay for help at home, medication and or equipment, support for veterans, especially those suffering from PTSD. We have a very large veteran population in the area. We have multiple naval bases, Army and Coast Guard. I don't know if there's an Air Force base, but regardless, we have quite a few veterans in the area, and that is a chief complaint. Let's see. What keeps people from being healthy? What are barriers to achieving good health? The synopsis from the health needs assessment was the high cost of care and lack of knowledge, lack of insurance, dysfunctional families, lack of transportation, stigma of mental health diagnosis, lack of family support, cyclic behavior of bad decisions, not accepting accountability, healthcare providers being overbooked, not being able to spend enough time with their patients. I think this goes into the part about all of our cities being so close together. While we do have those very rural areas, our hospitals do get really overrun because we are serving such a big population in this area. So let's see, what is being done in our community to improve health and reduce the barriers? So these are those resources that we're looking for in the area to help discourage health disparity and improve health access to health care and improved wellness in my community. Senior Services of Southeastern Virginia, Healthy Families Virginia Beach from the Virginia Department of Health. They provide support to expectant parents and families with young children. Virginia Department of Health Clinic, the Norfolk Community Services Board. They assist with treatment programs for people with substance abuse. Hampton Veterans Affairs provides assistance to our veterans. I Ride Transit from other senior services of Southeastern Virginia that provides free transportation. Care Connection for Children from CHKD, which is the Children's Hospital of King's Daughters. Program provides case management and care coordination services with independent private specialists and practitioners regardless of a family's income. The Food Bank of Southeastern Virginia and the Peninsula, in addition to the Salvation Army. So I think that one of the biggest issues that my area is facing is knowledge and how to access those resources. So this could be where occupational therapy comes in and advocates for occupational justice in regards to healthcare, being an advocate for yourself and your healthcare and your well-being and your wellness. Maybe trying to be at one of those resources just to provide education, or if you are seeing someone in a skilled nursing facility who be leaving doesn't really understand how maybe their website, their healthcare website works and how they receive alerts now. Reviewing that's an important way to access healthcare now, and just educating people on how to manage their healthcare is promoting occupational justice for patients, because advocating for your health and your well-being is advocating for yourself and being able to participate in daily activities or your preferred leisure activity, doing day-to-day tasks, being a parent, working. All of those things are tied together. So I think in my area, access to healthcare, education about resources and healthcare, and maybe looking more into telehealth. Those would all be areas to decrease health disparities. Thanks.